Well, back in 1995, I was diagnosed with bladder cancer, and by the time it had been diagnosed here locally in my hometown, it had advanced to a pretty good stage. The urologist here was quite candid with me and said, "You're going to need to go somewhere else." I selected Duke because Duke had some of the best doctors in urology particularly. Dr. George Webster literally invented the procedure that I ended up having after the surgery, the initial surgery by Dr. Paulson. And so I felt pretty good knowing that I was in the hands of the Thomas Edison of bladder surgery, so to speak. Their entire team that they worked with were about as dedicated a group of healthcare professionals as I ever recall seeing anywhere. I've always been sort of a give back sort of person. Any gift that I've received in the way of services, or in this case, my health and my life, I've always felt that it's important to give back to the extent that one can. In the middle to late 90s, I began giving an annual gift. Then the charitable remainder trust was presented to me as a good opportunity to even expand that gift giving, and I think that turned out to be a very good tool. Obviously, there are tax advantages and there are long-term investment advantages, because although the body of the trust certainly stays with Duke and they get the long-term benefit from that gift, I do get back a nice little quarterly amount of income from it. That's just another investment tool that I use. And two, the initial gift carries with it a tax advantage if you're looking for tax deductions. I'm not sure I was getting a better return on any other investments right now. Going in now into the second year, I've been very pleased with the performance record. Now, as far as the administration of it, I don't think there's any question that those folks are really set up to do real world-class professional work. I trust them just as much as I would any investment advisor or any financial institution. They sat down with me and explained everything fully, and they keep me advised on what's going on with the performance and the administration of the trust. It makes me feel good to know that in a day when federal funding for research, for example, is being cut, and the medical profession, generally the healthcare profession, is under a lot of stress to get a lot of things done, it's good to be able to help them out a little bit.